Let's talk about perioral dermatitis. I have so many friends who struggle with this, and even celebrities like Hailey Bieber has shared her journey with this skin condition. I'm Dr. Hannah Kopelman, and if you like what you see, keep watching so you can learn more about what it looks like, what causes it, treatment options, and how to best cope with it. So when I took a look at my friend, I was able to diagnose her with perioral dermatitis because she had a persistent red rash with discrete papules and pus-filled bumps that were small, red, some of them were raised, they were all kind of even in size, and then I looked at the distribution. They were around her mouth, her chin, at the base of her nose, some on her cheek area, and even some around the eyes. They also had a bit of a scaly and flakiness to them, but I knew that it wasn't rosacea, eczema, acne, or a contact dermatitis. So when I asked her if she felt any symptoms, she actually said at the time she felt okay. But then she started to flare and she started to complain that her skin felt raw, almost like an uncomfortable burning sensation. She didn't really complain of itch, but it was just that irritated feeling on her skin. And I'm sure all of us at some point have had that feeling from some sort of rash at some point in our lives. So immediately I knew that this was perioral dermatitis. However, I do want to mention that many people with perioral dermatitis don't have any symptoms at all, except for that red persistent rash that relapses over and over again. Unfortunately, like many other inflammatory skin conditions, we don't know an exact cause. We do believe that genetics plays a role, and we know that people with a history of rosacea, eczema, and sensitive skin are more likely to develop perioral dermatitis. With that said, we do know that there are many triggers that can play a role in the development of this rash. So just like Hailey Bieber said, her triggers she noticed were new products, products that were too harsh, wearing a mask, even sunscreens with certain SPFs in them didn't work for her, detergents with new fragrances were no good, so now she uses hypoallergenic detergents, which I'm a big fan of also, and even the change of weather would flare her perioral dermatitis. I'm going to go into a few more triggers that I often see. The number one trigger is the recent use of topical steroid ointments or creams. What I typically see is someone develops a rash on their face that's red and they are eager to get rid of it, just like you or I would be. So they run to their local store, buy some hydrocortisone 1%, start applying it all over their face, and it cuts the redness and things are starting to look better. The inflammation is starting to go away. But as soon as they stop using that steroid, it actually triggers a perioral dermatitis flare. And it's actually called like a rebound reaction. And this cycle just goes on and on. So then they start applying it again, and then they stop using the ointment and it comes right back. So if this sounds like you, stop using your topical steroids immediately. Other possible triggers are steroid inhalers, nasal sprays, fluoride toothpaste, or toothpaste that contains an ingredient called sodium lauryl sulfate. So try to choose a toothpaste like Tom's Organic that doesn't have fluoride in it. Also be careful of minty or cinnamon flavors. So if it's in your mouthwash, your dental floss, or even your chewing gum, I would try to eliminate those. A few other triggers include environmental. So I often see people flare if they just came back from a ski trip where they had a lot of exposure to UV rays and windy environments, or they're just sitting out in the sun. That could also flare, just like rosacea can flare in those environmental conditions as well. Hormonal conditions also can play a role, so the use of recent oral contraceptive use, or you may notice that your perioral dermatitis is actually flaring with your menstrual cycle. If you're using harsh skincare products like cleansers, topical exfoliants, or even retinoids, I would also avoid using them. In my friend's case, none of the things I mentioned were really triggering her perioral dermatitis outbreak. And as you can imagine, it's very frustrating not to know the culprit. So what I suggest for everyone, including you, be a product minimalist during this time. Eventually, we'll slowly add back in your products and your cleansers and your moisturizers, but at this time, try to eliminate anything that you apply to your face. I do want to put it out there that perioral dermatitis is a very benign, harmless skin condition. It is frustrating though, especially when you're someone who it relapses in. And in Hailey Bieber's case, and also in my friend's case, it goes away and it comes back and it goes away, and that's very normal for this condition. So that relapsing and remitting course of it can get frustrating and exhausting. So how do we treat this frustrating condition? Be a product minimalist. This is what I tell everyone. And what do I mean by that? Simplify your skincare routine. And this goes down to your cleansers, your moisturizers, even your SPFs. Use the bare minimum, even I would say water. And this is probably the only time I would say avoid putting on sunscreen and obviously avoid sunlight. I would also be careful of your makeup that you're choosing. And I know it's hard if you're going out, going to work, being social, and you're not just in your house all day, that you probably want to put on some makeup, but try to put the bare minimum in those areas. You don't need to spend a lot on your skincare routine. Choose products that are gentle, fragrance-free, and good for sensitive skin, because you have to treat this like a problem that occurs in sensitive skin individuals. So a few names that I recommend are Vanicream, Cetaphil, or CeraVe. Also try to choose things that are lightweight. As I mentioned before, some SPFs can trigger perioral dermatitis. So if you live in a sunny environment and you can't avoid those UV rays, then opt for sunscreens that have mineral-based ingredients in them, like titanium dioxide, because we know that those are less likely to cause any flare or rash or reaction. Also, try to choose wide-brim hats, seek shade, wear sunscreen, and use UPF clothing. And of course, the number one thing I want you to stop if you're using it is any topical steroid ointment. Stop them immediately because we know, as I said earlier, this is the number one culprit for perioral dermatitis. The goal here is to find out which product or chemical is causing this reaction or rash. And of course, as I said, sometimes we just can't identify it, but try to eliminate everything that can be making this condition worse. So just a quick recap. Take a product holiday, be a product minimalist, avoid topical steroids, avoid any nasal sprays or inhalers that have steroids in them, avoid fluoride toothpaste, mouthwash, dental floss, or mints that have minty flavors or cinnamon flavors. And then, of course, try to choose products that are gentle, clean, fragrance-free, and sensitive. If you find your perioral dermatitis is not clearing on its own, or you just simply want to get rid of it because you can't stand looking at this red rash or bumps on your face, then I recommend trying prescription options. You can start with a topical antibiotic like metronidazole, or you can even try an anti-inflammatory like pimecrolimus or tacrolimus. The way to use these topical options is twice a day until your skin clears. Once your skin clears, you don't want to just suddenly stop it. You're actually going to continue using those topical options for another 2 to 4 weeks. This is a way to prevent rebound flares. And then hopefully at that point, your skin will be clear. If you find the topical options are still not clearing your skin completely, then you can also try an oral antibiotic. So the best option is either a doxycycline or azithromycin if you're allergic to doxycycline. So usually I suggest a 2 to 3 month course on doxycycline, and I like to put people on doxycycline hyclate because it's better for their GI system and doesn't cause as much stomach irritation. I always suggest also giving them an antifungal so that they don't get a yeast infection because they will be on a long course of oral antibiotics. With the use of oral antibiotics, I assure you that your skin will get better. But again, we have to be very careful at weaning you off the medicine slowly so that you can avoid a rebound course of your perioral dermatitis rash. Remember, perioral dermatitis is temporary. Yes, it can come and go, but it is temporary and you can get it to go away and your skin can get clear. Once your skin is clear and you've achieved what you want to with your skin, then you can slowly reintroduce products back into your routine. So you could start using your makeup again or your favorite cleanser or your favorite moisturizer. I don't want you to think that you have to eliminate everything and just be in this situation where you can't use anything that you love. I would just always recommend slowly reintroducing everything one at a time so that if you suddenly notice your skin flared with, say, a certain blush, then you'll know that in the future, don't use that blush. My goal today was to clarify for you what perioral dermatitis is. It's very difficult to distinguish it from acne, rosacea, or even seborrheic dermatitis, eczema. So I hope I was able to clear for you what the triggers are, the causes are, and the treatment options. If you have any questions or comments, leave them below, and I'll see you in the next video.